All right, got some more friends coming in here. Cassandra.
Hi,
Hey, how are you? Welcome.
thank you.
We're going to get started in just a few minutes.
Okay.
Yep. Okay, here comes someone else. Trying to read. Anitra, are you going to are you having just video or, I'm sorry, just audio or video? I don't
Is
see
it
your,
okay if I just do audio or
it is
should
absolutely fine. I always just check because I'm still
yeah,
learning.
yeah, and I'm
Just
on
make sure.
mute too because my kid is in the
Awesome.
background
I
yelling.
hear you. Thank you very much. We're going to get started in just a few minutes. Thanks for being on tonight. We'll wait about two more minutes and get started.
It's a good sign that you're not getting frantic emails that they can't log in.
No, yeah, that's been fine. The only people who have trouble with WebEx seem to be some of the board members have been in trouble. I don't know what that is. Patrick.
Oh, Patrick.
He seems to fade in that and one other board member. So I don't know if it's the connection or I'm not sure. Who knows? We soldier on.
Yes, we do. Best we can.
Right, exactly. Exactly. Yep. Yep. We got some more folks coming here. Somebody else join. Good. Welcome, everybody. We're going to get ready to get started. I think we have you all coming in on mute so that we can hear our presenter. You can access the chat if you haven't used WebEx. If you hover down on the bottom of the screen, you can type into the chat to go to everyone. I know that several of you sent some really great questions in when you registered, and Dr. Apgar is going to roll those responses into her presentation, but we will take a pause about halfway through if you have additional questions, or and then after slide 30, and then she will stay around as long as you have questions and try to answer those. So feel free to type any questions into the chat. If it's something that you asked on registration, maybe just hold off and see if she answers it, and if not, she can go into some more detail. So just welcome, everybody. Thanks for coming in tonight. And I want to introduce Dr. Leslie Apgar with Greenhouse Wellness. She gave this presentation last year. We had about 75 people in attendance, so there's been lots of interest in cannabis and autism, the uses and how it might work for all ages. Lots of questions, of course. And I'm just going to be checking my phone, making sure we don't have anybody emailing me that they can't get in. So far, so good. So without any further delay, and I'm sure some other folks will join us a little later, Leslie, we're going to have you get us started. If you could just give us tell a little bit about yourself, and then we'll just go right into the presentation. And again, if you have questions, just feel free to type it into the chat.
Thanks, Melissa, and thank you to all of you who are joining us tonight. Yes, I actually did give this, or a version of this, lecture last year, back in the days where we could be in the same room with each other. So it's a learning experience for all of us to learn how to do this on the web. So I appreciate everybody's patience as we get this done. I am actually a university-trained, board-certified OBGYN who interesting career. I practiced minimally invasive surgery and took care of women for about 20 years until I retired in 2017. Oh my gosh, 2017, when I took over full-time at Greenhouse Wellness, which my best friend and I started in 2016. We opened our doors in 2017 and have been rolling through there pretty briskly. It's been a very steep learning curve for me because cannabis medicine was never taught in medical school, and I didn't learn anything about it. I was a little disenchanted with traditional medicine, profits over patients, dealing with a laptop instead of a patient. There were a lot of pressures to practice medicine in a way that I wasn't comfortable doing it. So when the opportunity to bid for this dispensary came about, my best friend and I decided to jump at the chance. I never knew that it was going to be the most rewarding medicine of my life. So that has then segued into a book that we wrote called High Heels. And we started a line of cannabis products for women called Blasiva. And obviously I still have my medical spa, Pura Vida. So I'm a busy girl. Depending on what day of the week, you'll find me at a different business. But today we're going to talk about cannabis and autism. Now, a lot of you don't know what to expect when you think of a dispensary. Maybe you have a vision in your mind of what a dispensary looks like, but this is what Greenhouse looks like. Gina and I wanted to make it light and airy and whimsical and friendly, a place that our moms would feel comfortable, that anybody would feel comfortable from any walk of life. And so this is what it is when you walk in. Now, everybody knows that there is a huge problem with autism spectrum disorder, ASD, and there seems to be more and more cases diagnosed all the time. You guys know these numbers. We've got at least 1 in 68. I think that number might even be higher now. We know that siblings have a higher incidence. We know that there's no specific treatments currently available, and what we're looking for is to focus on decreasing disruptive behaviors, and training and teaching self-help skills so that our kids can have greater independence. We know from previous observations that cannabidiol, or CBD, which is one of the major components of cannabis, might include alleviation of psychosis, anxiety, and the facilitation of REM sleep and the suppression of seizure activity. And all of these things are very important in ASD. Now, cannabis is ancient medicine, ancient medicine, and it has been used as an anti-seizure medicine in the Middle East for about 4,000 years. So this is not anything new. It's been used heavily in women's health. In fact, here's an interesting story. When the 13 colonies were originally here in America, you had to grow hemp on your plot of land. It was a requirement because every part of the hemp plant, hemp and cannabis are the same thing actually. It's just that hemp by definition has less than 0.3% of THC, which is the other major cannabinoid in cannabis. And so every single part of that plant is useful and incredibly beneficial for food, for sailcloth, for rope, all kinds of things. Now, as it turns out, cannabis was part of our pharmacopoeia, meaning that doctors could actually prescribe cannabis to their patients. And it became a little bit hard to dose that medicine back in the day with tinctures because the tinctures were not necessarily the same dose from bottle to bottle. And so when morphine tablets were made available and aspirin tablets were made available, those dosages were more reproducible. And so that was sort of one of the things that pushed cannabis out, and it wasn't as popular as a medicine anymore. But here's something that you could have bought. You can see it was right here in Baltimore called Chlorodyne, which was the brand name. And it has morphine in it, has cannabis, it has a little bit of peppermint. It's got some good things in there. Now, DuPont and Mellon and others all kind of got together and started a push to get rid of cannabis. And it's very interesting because DuPont, who you know is one of the makers of nylon, he couldn't make anything as strong as what hemp was naturally, a rope of hemp. And so that was a problem. Coca-Cola used to have cocaine in it, and they really enjoyed the fact that they had the corner on the market of the drugs and they didn't want cannabis competing. So they actually did studies on cannabis to see if it was as dangerous as everybody was making it out to be. And it turns out that the studies were found to show that cannabis was very safe. It did not lead to the use of morphine or heroin addiction. It didn't increase crimes or juvenile delinquency. And one of the studies that I found fascinating is that a lot of the people who turned to cannabis naturally would be what we would now call Asperger's. It was very interesting. It's like they were self-seeking. They knew that that was perhaps a medication that could be helpful for their symptoms. So then comes Nixon, and he ignored the evidence. And for his own reasons, which we don't need to all get into today, he actually helped push cannabis to be illegal. So in 1970, it was classified as a Schedule I drug. Now, Schedule I drug means that it has absolutely no accepted current medical use, and there's no accepted safety profile for it, and that it has a high potential for abuse. So that's actually the definition of a Schedule I drug. Funny enough, the U.S. government helped to get Marinol, which is synthetic THC, approved in 1985. So which is it? Does cannabis have no accepted medical use, or does it? Because it seems like Marinol, which was used for nausea and vomiting associated with with chemotherapy. It seems like that's an accepted medical use. In 1996, then California was the first to legalize with their medical program way back in 1996. You guys probably already knew that. And then here's the kicker. In 2003, the U.S. government received the patent for cannabinoids as antioxidants and neuroprotectants. So they have data and they have numerous studies that back up that cannabis actually has medical benefit. And yet to this day, it still persists as a Schedule I drug. So let's put this in perspective a little bit. We have 6 million deaths annually from tobacco. We have 3.3 million deaths annually from alcohol. We have what you can see here, 480,000 deaths in a year in the United States from tobacco. We have 88,000 alcohol deaths in our country. How many do you suppose we have from cannabis? How many deaths do we have? I want you guys to think about that. Here is a graph that is going up, 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 up. It's very steeply going up. Last year I have is 2017. It's not quite as steep in 2018, but it's still going up. This is the total U.S. drug deaths. 0 cannabis deaths. And the reason is because there are no receptors in your brainstem. Your brainstem is your most primitive part of your brain. It's responsible for breathing and for your heartbeat and things. And you can certainly suppress those with too much alcohol or with morphine or heroin, fentanyl, you know this. So in cannabis, there is really no physical way that you could kill yourself. You just can't. Now, that said, you can certainly take too much and feel like you're dying because you had a cookie in Colorado and it had way too much cannabis in it, but it's not going to kill you. Now, this is a very interesting statistic. We looked at, this is the Journal of American Medical Association, that states that have a legal cannabis program have a 24.8% decrease in opioid-related overdoses, and that strengthens over time. Little interesting tidbit. Now, in Maryland, autism is not specifically an approved condition. The approved conditions are listed right here, but I'll tell you that said, there is a special category called other, and most of the certifying physicians in Maryland are choosing other because we certainly treat a lot of anxiety, we treat a lot of PTSD, we treat a lot of chronic pain, but there's some people that come in and their situation is not one of the approved. And so other is probably the most common box that's checked when people are getting approval in Maryland for the program. Okay, so some of you who were at the presentation last year saw this slide and the number of certified patients was like around 60,000. So you can see it is increasing greatly. Now, my business partner, Gina, my best friend, the one that started this whole endeavor with me, we scratch our heads all the time and we're wondering, why are the numbers going up so quickly and why are the numbers going up now? And I think that part of the reason that it's increasing so much is that the stigma is going away ever so slightly, and that more and more of us are talking to friends and family members and people who are part of the program, and they're hearing the success stories. So it's making it less of a negative conversation and more of an interesting, positive conversation. So I think that might be part of it. Here's sales for the first year. This is updated April 8th of 2019. You can see the high upward trend of sales monthly. And then here's what it is from December of 18 to December of 2019. And you can see that the numbers are just going up and up. And that's consistent with the increase in number of patients that are coming in. Okay. Does anybody have any questions before we get into the science of the endocannabinoid system and what's really going on here?
I have a question if you just type into the chat.
Yeah.
I don't see anything yet, but give you just a minute if you has anything they want to ask. Oh, a couple of folks just joined us.
so much of this is a language that we never learned how to speak. I certainly didn't know any of these words in medical school. So for the lay public, hearing the words cannabidiol and THC and the endocannabinoid system, these are very weird words to hear. So this is good just to kind of hear it again and again and again.
Mm-hmm.
Melissa, if you have a question, just go ahead and interrupt me at some point.
Not seeing any questions, so why don't you keep going, Leslie? And if you think of other ones, guys, just type it right in and
we'll roll through. So what is the endocannabinoid system? Who knew that we all have an endocannabinoid system? And who knew that we all make our own cannabis every single day? Who knew this? It's crazy to think about, but we do. Everybody except for, I think, insects has a endocannabinoid system. It's an ancient, probably our most primitive nervous system. And it's really that mind-gut connection that we kind of sort of knew that we might have, but we didn't know what it was called, and we certainly couldn't name it and identify it. But this is what it is called. It's called the endocannabinoid system. Our own cannabis, one of them is called anandamide, which was discovered way back in 92. And another one is called 2-AG, but there's other components. Now, these components are made rapidly on demand in the cells, and then they're rapidly degraded. They're not stored. But the endocannabinoid system and its receptors are found all throughout the body, and it is what provides balance. That's what homeostasis means, balance and health. So if you think about the most basic functions, relax, eat, sleep, forget, and protect. That's what the endocannabinoid system is doing for us all the time. And you can see that there are receptors all over our body. There are CB1 receptors, which are what THC preferentially bind to, that are more present in our central nervous system and in our brain. And then the CB2 receptors that are more in some of our internal organs and mostly in our immune system, really important in immunity. So cannabinoids, that's a really hard word. What is a cannabinoid? Cannabinoids are different compounds that have therapeutic value, and they are found in cannabis in high concentrations. They're called phytocannabinoids, which means they come from a plant. They're endogenous cannabinoids if they're created by our own bodies, what we were just talking about, anandamide and 2-AG. And they're synthetic if they're made in a lab. Now, CBD has been used for a long time to treat pain, cancer, neurodegenerative diseases. And it's really unclear what CBD does to THC. We think that when CBD is there, that it creates a tolerance to THC, meaning that the user does not get the negative side effects of THC. So what I'm constantly telling my patients and constantly telling my staff is that CBD is the most important cannabinoid. And when the plant was created out there in Mother Nature, before humans came along and bastardized it and took all the great pains in breeding ever stronger THC versions because it was made illegal and it was in the underground, the natural state of the plant was to have much more CBD than THC. So we know that CBD has a therapeutic effect on seizures. In fact, Epidiolex is now available commercially for that purpose, which again, you have to query, why is it still a Schedule I drug? Why is cannabis still a Schedule I drug when we have all these different components of the plant that have therapeutic value? Okay, let's see if I can get the slide to go. There we go. THC, everybody's heard of THC. THC is what causes intoxication in levels that are high. And what THC does, though, is help with pain incredibly well. It is a great antioxidant and an anti-inflammatory. In fact, it's 20 times stronger than aspirin, 2 times stronger than hydrocortisone. And it actually inhibits prostaglandin synthesis in a way. You guys have heard of things like Celebrex and different kind of anti-inflammatories that you could take for maybe arthritis, and they had terrible GI side effects and they were actually harmful. cannabis, THC, and CBD can do that in a way that bypasses those negative side effects so that patients tolerate them much better. So really, really good anti-inflammatories. Together, THC and CBD have a synergistic effect, and they're also really good at protecting the brain. And they are better actually than vitamin C and E as far as really potent antioxidants. Epidiolex is that seizure medicine that I talked to you about, but it's really, really high doses. These are seizure disorders that some of you may not have even ever heard of. They're really significant seizure disorders in kids. They have 300 or 400 seizures a day. And cannabis was really able to, CBD was able to really give a drastic reduction in the amount of seizures, which was wonderful. So I said entourage effect. What does entourage effect mean? That means that all of these components that are present in the plant, in the cannabis plant, work together to give you a better outcome. That means that if I just gave you CBD, you would get some benefit, but you wouldn't get as much benefit as if I gave you CBD with a little bit of THC and some of the other terpenes and other flavonoids and the other things that are in that plant that make it work really well. So it is very complicated. And for a Western trained doctor like myself, this is very strange. I'm not a naturopath. I didn't go to school to study plants and all of these things, but I should have, as it turns out, because I'm really having to study and learn that stuff now. But it turns out there's probably 400 or 500 different things in cannabis that are all working together to give the outcome that you are looking for. And depending on the different ratios of CBD, THC, terpenes, and flavonoids and all of that, it gives you a different effect. I know people have a lot of questions on strains of cannabis. We can talk about that a little bit more too. So terpenes, what in the world are terpenes? Terpenes you guys have been eating and drinking your whole lives, but you never realized it. Pinene is in pine needles. And so the feeling that you get when you walk in a forest, in a pine forest, in fact, in Japan, it's called forest bathing. And it is a practice that actually relaxes you. And it turns out that it opens up your bronchioles. It actually is a bronchodilator. So it's a treatment for asthma. And it is really good for, and it's an antibacterial. Linalool, everybody knows lavender, and a lot of people would spray lavender on their pillow or put it in a bath salt or use it as a massage lotion. It's calming, and it's really good for anxiety, and it's actually, it works as a treatment for seizures directly. Beta-caryophyllene is in black pepper, and it is interesting because it is a cannabinoid and a terpene, so it actually has direct effect on the receptors independent. And beta-caryophyllene is the component that drug-sniffing dogs were trained to smell for in your luggage when you flew. But now the drug-seeking dogs are looking for bombs. They're not looking for your beta-caryophyllene. So I have patients ask me about that all the time. Myrcene is really popular. That is what is used to really get that deep muscle effect of when patients have really bad muscle pain. And myrcene actually it increases the permeability of your blood-brain barrier. So it potentiates or makes greater the effects of the cannabis. So if you've got, say, cancer and you've got terrible debilitating pain and you really want a bigger effect, you would look for a strain that has myrcene in it. And then last, limonene is what they put in our cleaning supplies, that lemon fresh scent. It makes you happy and uplifted. It makes you want to organize your pantry and alphabetize it and do all the things. So it's interesting that these terpenes or aromatherapy actually do work, and they actually do have direct effects on our brains. So it's very interesting how this all works together. Now, people have emailed me, I don't want to inhale it, I don't want to smoke it. Well, no kidding, nobody really does. And that's what the myth is that they think that cannabis is just smoking or vaping, but that's not really the case, especially in our younger population and in our ASD population. That's not usually the go-to. It is one option. We can vape either the entire flower ground up into a flower vaporizer, or we can use concentrates or oils that are then vaped. And I know that some of you have heard about this vape crisis. We call it Vape Gate at Greenhouse because it was really the black market things that were completely unregulated, that nobody was really testing, that kids were buying at gas stations or what have you, that was the culprit. And nothing that is in Maryland has any of those components that's going to cause that kind of lung injury. And the medical commission, it's called the Maryland Medical Cannabis Commission, the MMCC, as frustrating as they have been as far as getting this program up and running, I can tell you with great certainty that they are testing every single thing, and I can provide a certificate of analysis to a patient or consumer on anything that is sold in a dispensary in Maryland. And that is a very comforting thing because it's not like that in other states. So for all of Maryland's faults, I have to really give them credit where credit is due. Okay, sublingual. This is my favorite. So tinctures are ancient medicine, and that is what we used to do anyway back in the 1800s, early 1900s. Tinctures work in two ways. Number one, if you are able to medicate with a tincture, which is a liquid from an eyedropper under the tongue, you're going to get immediate absorption through the oral mucosa. And that means that the medicine goes right into your bloodstream and is not converted to something else by going through your gut and going through your liver and getting converted into other components, which is more than we really need to talk about. But whatever is not absorbed through the oral mucosa is then swallowed and processed by your gut and turned into chemicals that are then stronger and last longer. So you get kind of a 1-2 punch with anything sublingual. A lot of our ASD kids can't tolerate anything like that, and parents have to disguise it in pudding or juice or water or whatever. And that's fine too. I actually really like microdosing, which means taking a dropper full of cannabis and putting it in something that the child will then be drinking or consuming through some period of time. I also like that for the adults as well, the non-ASD population. We also have cannabis in tablets, in gummies, capsules, all kinds of things that are then swallowed. Not edibles yet, and the reason is because of food safety. We want to make sure that our food sources are as safe as our medical sources, which means that if you buy cannabis from me at Greenhouse, I can assure you that it doesn't have E. coli or salmonella in it. Well, if I'm going to sell you a chocolate bar at Greenhouse, I need to be able to give you the same assurances. And so again, while we might be irritated at Maryland for not rolling out an edible market as quickly as my patients would want it, I'm very grateful as a physician that they're doing it safely and that we can all feel good about that. That said, I do have things at Greenhouse that you and I would think are edibles because they're like gummies. They're just in a medicine bottle, but they're like a gummy. So we have elixirs, which you can drink. And then we have a host of topicals. We have lotions and balms and patches and bath soaks. It is quite a constellation. But no, nobody has to vape or smoke cannabis. In fact, most of my ASD kids are not going that route. Now, what I do like about vaporization, though, for other conditions is that depending on the temperature that you vaporize, and vaporize means basically steaming the flower, you're going to get all the good stuff out of that plant. You're going to get all of those terpenes and all of those cannabinoids that vaporize at different temperatures, and you're going to be able to get a better treatment overall. So for a more sophisticated user, I do have to concede that vaporization is a valid treatment option. When Gina and I first started this whole enterprise, we were like, oh, it's like tawdry. We don't want anybody smoking or vaping. That's gross. But as I've learned more about the medicine and the physiology of it, I do see the place for this. Smoking, I'm not a big fan of. When you combust, you are basically burning and you're creating all kinds of carcinogens, and you're basically getting all the good stuff is going up in smoke. You're basically combusting it. You're going right to THC. So it's not my favorite. I really do try and get people to change from smoking to vaping if I can, and I encourage them other ways of taking in the medicine. So tincture is my favorite. You can see the typical medicine bottle there with the little eyedropper. And then we have all kinds of mints and gummies and tablets and capsules. We can do medication in all kinds of different ways. But why I like tinctures so much is that I can individualize it. If I've got a 5 milligram tablet, I mean, I suppose you could cut it in half if you got a pill cutter, but with a tincture, I can really customize the dose based on who the patient is and how they're doing symptomatically. And I guess maybe I'm a control freak, but I do love the ability to control the dosing that way.
Leslie, we have a question on the tinctures, if we could, since
Absolutely.
you're on. How long would you need to take tinctures to see any type of results?
So by 16 weeks, which is 4 months, you should definitely know that you're going in the right direction. If you've not seen significant progress in 16 weeks, sorry, in 4 months, then cannabis is probably not for you or for your child or whoever it is that you're trying to treat. It is a start low, go slow kind of a process. And it can be frustrating for patients who are at their wits' end and for caregivers that are at their wits' end. But truly, in about 10 days, I see patients back. The naive users, the ones who are cannabis virgins, so to say, and they come back and I talk to them 10 to 14 days later and I ask if they're having any side effects, I ask how they're doing with their symptoms. And oftentimes the symptoms were so subtly improved that they didn't realize it until they started talking to me. And then they realized that they haven't been taking their sleeping pill really, and that they haven't really been taking their Aleve so much anymore. It's very weird, but it sort of sneaks up on you. It's not like you were to take an oxycodone tablet and really feel it. Cannabis just makes you better able to handle the stresses that come at you. It raises your threshold a little bit so that if you're likely to fly off the handle at a level 2, maybe you can go up to a level 4 or a level 5 before you feel like you're going to fly off the handle. But it's a very subtle thing for most patients.
Thank you. Great.
So there are some pictures of some what you and I would call gummies, but in my dispensary we'll call them troches because they're in a medicine bottle. But those are basically an oral medication that would be a little bit longer lasting than taking a puff on a vape or smoking a joint or something like that. This is just a longer lasting way of medicating, much like tinctures are. Topicals, so you can see the patch there, those are super popular because they can last up to about 18, even 24 hours for pain relief. The balms are great for anybody with arthritis. Bath salt's great. You can soak your troubles away in the bathtub and you get like kind of full body analgesia, but it doesn't affect your brain. It doesn't intoxicate you at all. It just stays in your tissues. So a lot of people, funny enough, have their security clearances and they're worried about testing positive. But this kind of way of applying cannabis to your skin is a way that you're topically, meaning that your elbow, say, won't hurt from your tennis elbow, but it's not going to make your brain fuzzy, which is what most of my patients want. They want to be fully functional, but they want their pain to go away. Now, what you probably know, or maybe you don't know this, most of the medication that we are given by our physicians are all cleared by a certain pathway in our liver. It's called the cytochrome P450 system, and it's something that we learn a lot about in medical school. And everybody always asks me, well, isn't cannabis going to affect my other medications? And my comment is that everything affects all your other medications. Any medication that you take affects all your other medications. So I don't mean to be cavalier about it, but everything you ingest is probably going to be affected by that same pathway in your liver. So if anybody is concerned, if somebody's on a ton of different medications, if somebody's on something that they're worried about, and one thing I would actually worry about is blood thinners. I don't worry about too much else, but blood thinners, people, high users of cannabis, have had situations where Coumadin, which is a blood thinner, has resulted in bleeding times that are too long, meaning that people are more likely to bleed, and that would be significant to me. So to be safe, we separate cannabis by 2 hours from other medications, if patients are very concerned, because there's a lot of trepidation about this, especially for my parents of their ASD kids. They're appropriately concerned, and they know how to do a lot of research, which I very much appreciate. But I'll tell you that we haven't seen any issues with cannabis interacting with other medications. And we've been at this for about 2.5 years. So it's certainly reported in the literature, but it's not anything significant that I have seen yet. So I will open it up for questions, and then we'll keep going.
We have 2 questions. One is about the previous slide. You weren't clear whether topical applications will show on a drug screen.
They will not, but that said, if you are using one of these patches that last for up to 24 hours, some of those patches are micronized, which means that they are facilitating the transfer of the molecules into your bloodstream. And there is a chance that if you use those patches a lot in that way, that you could show up as a positive. But I will tell you that those individuals that just use the lotions, the balms, the bath soaks do not test positive.
Thank you. And then also, if you could talk again about what elixirs are used for.
Elixirs are drinks. They are berry lemonade. There's a lemonade iced tea one. There's different flavors of them. And sometimes we get powders that you can then add to water and create your own. They are typically just THC. I haven't seen too many that have CBD in them as well, but we sell an enormous amount of elixirs to older individuals who can't sleep. And let me preface this by saying our dispensary, the average age is somewhere between 50 and 60. It's certainly trending down, but the cannabis patient that you might think of in your head of what a cannabis patient looks like, you would think that you're just with your peers if you come into Greenhouse, because you will see judges and you will see doctors and you will see teachers and you will see any normal person like from every walk of life is in there getting medicine for whatever ailment they are suffering from.
Mm-hmm. Thanks. We have one more question. How would a parent determine dosing for a child?
And we're gonna get to that right now. That's a great question.
Right,
and that's the $1 million question. I mean, how do you determine dosing? But yeah, we're gonna go over that.
And then there's a question about health insurance, which covering.
Nope. It is cash only, which is really depressing. You can't have a Schedule I drug, meaning that it's federally illegal, and then have your insurance company pay for it. So it's complete crap. So at some point we need to vote to get this off of Schedule I. It's complete nonsense because I don't know how much the government's making on their patent of this, but it's really silly because if you take it off of Schedule I status, you can study it and you can get U.S. randomized controlled trials and really get some good data in there so that doctors can be helped instead of just relying on Israel and Canada and Uruguay and other countries that have legalized it. And then what mostly we rely on is just a ridiculous amount of anecdotal cases. And anecdotal cases that's not good science. That means that since I've started Greenhouse and I report to you all the things I've seen happen with cannabis, but I've never done a study or a trial. And doctors really want randomized controlled trials. That's how our brains work, and that's how you know that something is actually helping.
Okay, very good. Okay, and then we'll get to the question about dosing later. So I think we can move on.
Okay.
Yep.
All right, so here is a study from 2018 that looked at kids with autism, and it was not a huge amount. It was only 60 kids. And they ranged in age from 5 to almost 18. Most of them were male. 77% were low functioning. And what you'll see most of the time when you're looking at pediatric studies is you're looking at a ratio of 20-1 or so of CBD to THC. Okay, now remember what I said. CBD is going to work to some degree. You're going to get some response. And a lot of the patients that come in and start this whole process have either started their kids on CBD or are considering starting them on CBD. That's the way I started with my own family and, you know, with my friends and with whoever. We all started on CBD first. And CBD does have a benefit, but if you want that true magic, you really do need the other components, and CBD with THC works so much better. And so that's why you're going to see the THC in here as well. But it's a very, very low amount of THC. It's not enough to create intoxication or impairment in any way, shape, or form, because that is not what we are looking for at all. So you can see that behavior outbreaks were either much improved or very much improved in 61%. Communication improved in 47%. Anxiety improved in 39%. And that means that it was either much improved or very much improved. Okay. And here's the kicker. Parental stress decreased 33%. That's huge. I mean, I don't know how you guys do it. You are all wearing such incredibly bright halos, and your capes are very long and shiny. You guys are in the trenches every single day. So I bow down to you, and I took special note of parental stress decreasing at 33% of the cases. And then disruptive behavior, which obviously when it's good, but when it's bad, it can be really, really bad. That also improved in almost 30%. Here's another situation with a lot bigger study. It was 188 ASD kids were treated for a couple of years. And again, a 20-to-1 ratio of the oil. It was a 30% CBD and a 1.5% THC oil. You guys, that is like nothing. If I were to take a naive patient, meaning somebody who's never, ever tried cannabis before in their life, and I wanted to give them THC, I might give them 1 milligram, I might give them 2.5 milligrams, but most of the starting doses is something like 5 milligrams. So this is really, really low THC. And you can see that when they were assessed at 6 months, they had 30.1% significant improvement. And they had 53.7 moderate improvement, and then only 6.4% slight and 8.6 no change. Now, the side effects that they did report, the most common was restlessness. So they did report at least one side effect, but I would consider that to be a fairly minimal side effect. And the patient population studied in this, the average age was almost 13. And there were some 5-year-olds all the way up to 18-year-olds. About 82% were male, 14% suffered from epilepsy also, and a small amount also had ADHD. The quality of life, mood, ability to perform activities of daily life were assessed before and that at 6 months. So we're just going to kind of do a little bit of a deeper dive into this so you're understanding what these numbers actually mean. So good quality of life was reported prior to treatment at 31.3%, after treatment 66.8%. That was at 6 months. That means that, here's another one. Ability to dress and shower independently rose from 26.4 all the way up to 42.9% at 6 months. Good sleep was rated at 3.3% before and 0 for concentration before. And those increased to 24.7 and 14%. So I don't know if any of you don't sleep or have kids that don't sleep well, but sleep is like one of the most important things in the world, because if you don't sleep, then everything is worse the next day. You can't tolerate anything. And so when you can improve a patient's sleeping, you have really turned the tide. And I can't tell you the number of patients that come in almost with tears in their eyes and talk about how they haven't slept like that in years. They don't remember the last time that they had that kind of good sleep. So THC, it turns out, is really helpful with creating stage 4 sleep. So there's different stages of sleep, and I'm not going to bore you with the details, but stage 4 is that deeply restful, cellular repair and all of that happens during that really, really deep, restful sleep. But with THC in your system, when you wake up, you don't know where you are for a second. I mean, you're in that bed so heavy that you don't think you even moved at night. It's like, I call it the sleep of the dead. And yet, when you swing your legs over the side of the bed and you stand up, you have absolutely no symptoms. You're not groggy, you're not foggy, you don't feel like you've been all Benadrylled up. Any of you who've taken Unisom or any of those sleep aids over the counter, or Ambien even, the different prescription sleep aids, there are definitely lingering side effects from that. So it's been really fun for me to watch people come back and talk to me about how their kids are sleeping better, or they are. A lot of people come in and talk to me about seizures also. And it looks like almost 85% of kids in the study had disappearance of symptoms. Only 2 patients reported improvement, meaning that they didn't disappear, but their seizures were improved. And then the restlessness and the really disruptive behavior improved in 91% and 90.3% respectively. So pretty significant increases in quality of life after 6 months of treatment from this one study. And I think, Melissa, we might have some questions. I don't want to go too far before answering them.
We do. Okay. How do you determine what product is appropriate for your child or teen and their specific issues?
So it really depends on so many different things. And in the before COVID, we would do consultations in person, and patients would come in with or without their child, and we would talk about exactly what's going on, because like all medicine, this has to be individualized, and it's not a one-stop shop, and not one thing works for everybody, but it's a little bit of a conversation. So what I would suggest is that if people have questions and they want to do a consult with me, you can email me at leslie@greenhousewellness.com, and it's Leslie.
I'm going to put it in the chat. Hold on.
Yeah, you can put it in the chat.
Leslie.
At Greenhouse Wellness. Because I'm not able to do consultations in person anymore, because we've changed our business model to be curbside only, just for everybody's protection right now, and it's working out really well. But one thing is hard for new patients is not being able to have like a good consultation. That said, we do sell CBD products only, and CBD are usually really, really safe to get sort of some baseline data with your child to see how they're doing. And we do have some of those available in different flavors. There's unflavored, there's lemon ginger, there's peppermint, lavender. There's all kinds of different flavors of tinctures. And that's a very safe way of starting your child. But I'm going to talk a little bit more about how we have to be careful about where we buy CBD these days, and the danger about what you might be able to get in your CBD if you don't get it from a reputable source. But we'll get there.
One more question. How does, I think this means milligram compared to percentage?
It depends on how concentrated the vial is. It depends on how big it is. So you could have a 20 or a 30 ml vial, and it could either have 1,000 milligrams in it or 1,500 milligrams in it. So it is a math problem, and you have to actually look at what you are trying to do as far as a dose to be able to answer that question intelligently. And that's, again, something that I can help with in an email. If you tell me exactly what you're trying to do, I can help you with the math to determine milligrams, because really what we're trying to do is talk about milligrams.
Mm-hmm. Okay, I think that was it for now.
Okay. So I talked to you guys already about starting really low and going slowly, and it's the advice that we give for most medications, especially in a vulnerable population like the pediatric population or the elderly population. But I want to reassure all of you who have younger kids that it turns out that it's not like other medicine, meaning children can tolerate a really high dose of cannabis and not have any ill effects from it whatsoever compared to adults that sometimes cannot. And it is not, interestingly enough, a weight-based issue. So it is very counterintuitive because in pediatric medicine, we're taught to dose based on weight. And it turns out that while that is an appropriate strategy and we want to always be safe, I just wanted to give you guys the background that it turns out kids can tolerate quite a bit without ill effect. So a huge wide range of dosing, okay? So in those studies, it could have been 1 drop of that 20-to-1 mixture, or it could have been 20 drops of that 20-to-1 mixture. And it was given usually 3 times a day because that's what TID means. Because of the half-life of the medicine, you actually have to give it about 3 times a day to have that consistent blood level. Now, some kids will tolerate that, some kids won't. I usually start just in the morning and we wait a week or so. We see how we're doing. And then we add in an evening dose and we see how we're doing for a week or so. And then we go to that midday dose depending on whether school or care, wherever your child's getting care, will allow you to treat them with such a thing during the day. I think there's been some recent legislation on that to protect our kids so that they can have access to the medicine that they need. But it really just sort of depends. And I know that our human nature is such that we want to compare to others constantly. We're looking for affirmation. We're looking for information from our friends and neighbors and comrades in arms. And I caution you against that because what works for one person is absolutely not necessarily going to work for you or your child. So really it's individualized, significantly individualized, and to start very low and slow is my perfect formula.
Good.
Okay, so what is all this nonsense? Why is cannabis working in autism? What is happening? So remember I said the endocannabinoid system was in charge of balance and homeostasis? It turns out that a lot of disorders or disease states may result from a dysregulation or an inadequacy of our own endocannabinoid system. And it looks like there's some data that shows that ASD is potentially a result of such a dysregulation of the endocannabinoid system. So let's pretend your endocannabinoid system is not working well and you have really low levels of a naturally occurring cannabis like anandamide that's in your bloodstream and it's really low. So if you then supplement with cannabis, with CBD, THC, with the other different cannabinoids, it's almost like you are vitamin D deficient and I'm giving you a vitamin D supplement. So then now all your cellular functions are working better. That's the way I think of this endocannabinoid system and the deficiencies that we see. So it turns out that the reason why kids may be doing better who are given CBD is that it helps with bonding and social interaction because it promotes the release of some very important hormones called oxytocin and vasopressin that come from our brain. It turns out that there's a study that shows that anandamide levels are lower in ASD kids, and so maybe supplementing with another kind of cannabinoid is helping even that system out. And then this last study showed that 3 to 9-year-olds have really high levels of CB2 receptors. And so in medicine, if I've got enough circulating cannabis, let's just pretend that we're calling our own body's medicine cannabis. If I've got enough of that circulating in my body, then I don't need high levels of receptors. Those receptors are recruited by your body to make sure that they can pick up any little bit that happens to be present. So if you had enough of that cannabis floating through your system, you wouldn't have to have high levels of CB2 receptors. They would be diminished. So that's why that has significance, if that makes any kind of sense. I know this is a lot more medicine than you guys probably wanted to learn. So in autism, this was in a 2015 article, the endocannabinoid system controls emotional responses, behavioral reactivity to context, social interaction, social award responsibility. It is densely wired through every single part of our bodies. It's altered in several neurodegenerative diseases and inflammatory states. It influences circadian rhythms. I don't know if any of you guys have kids that are off. They're like, I got the best card ever when I was a new mom, and it was in the front of the card said day, and the baby was sleeping like a log. It was just the cutest kid. And then you open it up, it says night, and the kid was like playing and laughing and crying, carrying on. And so sometimes our circadian rhythms are not right. And so sometimes if you can supplement the endocannabinoid system, you can correct for that. And obviously, you guys, I've seen so much more traffic and so many more new patients right now with COVID to treat their anxiety. I mean, people are really kind of clawing out of their own skin right now. And we have so many patients who report back that their anxiety is just so much better handled with a little bit of cannabis. And then we know, obviously, from some pretty significant studies that seizure activity, including epilepsy, is involved with the endocannabinoid system for sure. Okay, importance. Here's I'm going to get up on my soapbox really quickly. You can get CBD anywhere. You can get CBD at the drugstore, the gas station. You can get it from your neighbor. You can get it at Amazon, at Walmart. You can get it anywhere. Just because you can get it doesn't mean it's safe. This is unregulated.
Guys, make sure you're all muted if you would, please. I think we're getting a little feedback other than Leslie. Okay. Thank you.
All right. So sadly, this is unregulated territory. And with the latest farm bill that passed that allows hemp products to be transported across state lines, people are looking at CBD as like the green rush, and they're all trying to get rich quick. So I caution you that what you buy online may not be as advertised. And there are lots of studies to prove this. If you take random samples of CBD purchased over the counter, you will find that, funny enough, there's THC in there. Funny enough, it says it's 300 milligrams of CBD. It is not 300 milligrams of CBD. There might be contaminants in it. I very much caution you to buy reputable products. Make sure that you can get a certificate of analysis for each batch of CBD that is made. This is a plant, you guys. It's grown in a greenhouse, or it's grown outside. Plants, every time it's sunny for an extra day, or it rained a little bit too much, or maybe it was colder one day, that plant is going to be a little bit different the next time it grows. So you're not going to get the same exact combination of components in that CBD every single time you buy it. So you make sure you get a COA. Now, I have no interest in Social Brand. I don't own stock in it. I just know that they are the biggest CBD manufacturer in the country. They're out of Oregon. I love them as far as a company. They're easy to work with. They've got great customer service. And I and my family are on these medications and have been for years. My dog Max is 13 or 14. He is a puggle. He has terrible arthritis. He cannot go up and down the stairs. I gave him pet CBD from Social. I put about a quarter of a dropper full in his food in the morning, and now he trots up and down the stairs. We've taken him on the Appalachian Trail. It is truly amazing what this medicine can do. But I can stand behind social. People always want to know what other brands I know and love. I don't, I just sort of keep my head down and just try and take care of patients the best I can. They'll ship right to your house. We sell it at Greenhouse. I sell it at Pura Vida. It's a good brand. So you guys can actually go right onto their website yourself and buy it directly from the company. They sell a ton of different products. If you need help picking out what you want to start with, happy to discuss that with you. But again, this is from hemp, not cannabis. But remember, the only difference is that the plant grows less than 0.3% THC to be called hemp. But hemp and cannabis basically are the same thing genetically. Does that make any kind of sense? You guys have any questions?
I'm not seeing any questions right now. Anybody have any questions? Put in the chat. Okay. Go ahead and add them in as you go then. Oh, here was one. How is the research done legally?
So some of the research is done. There are limited universities in the United States that are government sanctioned, but it's incredibly difficult to get these studies done. A lot of studies I'm getting out of Israel, out of now Canada, but it's such a point of contention, and I just wish and hope that we can get some good studies, robust studies in our country, because the way that doctors in the United States are trained, we don't necessarily trust anything that's not here in America. For whatever reason, we really value highly U.S. studies. And so that's something that I would like to see, because 188, that's not a ton of numbers. And that's what's so frustrating about the cannabis space, is that I don't have the kind of studies that I'm used to be able to feel really comfortable in recommending it and speaking about it. So most of what we do in this space is based on whatever information we can cobble together. We share sources. I'm members of a couple different journals, and we actually are doing some good work these days, which I'm very pleased about. We've definitely made progress, but most of the information that we get is still anecdotal. So it's frustrating, to say the least. So it was a great question, and I appreciate you asking it.
Lots of good questions. Can you trust companies selling CBD who say organic and USDA certified?
I love that question. There's no way that a federally illegal enterprise is ever going to be able to have the organic label. So you can toss that out the window. That's not going to happen. With time and with patience, we're going to see safer pesticide use and safer, I can't even say organic farming, because it's a misnomer. You can't be labeled organic in this space. But I love where your head's at. I grew up in Seattle. I grew up with organic and vegetarian and the whole thing. And yes, I love leaning toward that. But there's nothing that I know of at this moment that has that kind of certification. Now, there is a company in Maryland that's trying to do GMP quality for cannabis, and it's pretty cool if they're able to do that. That will really change the game, because we'll have certified labeling, which is really going to mean something. So I do keep my fingers crossed that we're going to be able to make progress in this space. But that's a great question. Great question. And I'm going to look over my questions too and make sure I answered everything.
We have two more here.
Okay.
Maryland have reciprocity with Virginia if Virginia Virginia residents wanted to become patients.
No, it's a very sad thing. Reciprocity does not exist in the state of Maryland, and part of it is because of drug trafficking, because they don't want to basically have you come to Maryland, buy a federally illegal substance, and then transport it across a state line. That's considered drug trafficking. I'm sorry, you guys. I came home with the dogs, so I'm sorry about the noise.
Oh,
Anyway, it's this lovely working from home thing, isn't it awesome? No,
yeah.
Maryland is not honoring reciprocity, nor do I think that they're going to anytime soon for exactly the reason I just explained. That said, DC does offer reciprocity, and that is a recreational entity so that you can go into any dispensary and hopefully talk to them about, true medicine. And if you had a card in Maryland, they would offer you a discounted rate for medical products that are bought in DC. I know what I wanted to tell you guys. As far as somebody who will certify kids, because sometimes the certifying providers in Maryland don't have a license to certify children for whatever reason. So I will tell you that Patricia Fry, Frye, in Tacoma Park, is a pediatrician, and she's actually on a couple of boards with me. She's on a couple of journals with me, and we review articles together, and she's a lovely human being. And she wrote an amazing book that I actually make all of my wellness consultants read before I allow them to interact with patients at the dispensary. So in any case, her email, I wrote it down for you guys so that you can email her directly if you want to get your kids certified, is info@Tacoma Care, TacomaCare.com. So
I'll put it in the chat. So
TacomaCare.com.
Patricia Fry, Frye.
Yeah.
Will certify children. Okay.
Yeah. And she's somebody that I use as a resource because she's got a lot of experience with ASD as well. And she's been in the space longer than I have. And she's just a really cool chick. I think you guys would like her a lot. She's she's just a sweetheart. She's somebody that I would love to go have a cup of coffee with anytime that she's in the area. She's just a really, really nice lady. This was another question which I didn't really dive into on the difference between cannabis, sativa, and indica. And I know it's really hard for people who grew up thinking that there were two strains, sativa uplifting and indica couch, indica meaning more sleepy, more muscle. But it turns out that the more research we do on cannabis, the more we realize that if there used to be two different strains way back in the day, they're really all intermixed at this point, and the jury's really out on if there ever even were different strains. So what you have to do is you have to look at the terpene content, and you have to kind of direct toward what effect you're looking for and find a strain that has a certain combination of cannabinoids and terpenes to attack whatever problem you want addressed. And that's really hard because patients still really insist on having things labeled indica, sativa, or hybrid, or indica leaning hybrid, or whatever. And so it's a little bit of a game that the industry is still playing, trying to give the patients what they want, but there really is no such thing. Now, that said, I saw a very interesting presentation by a very smart scientist who had done research on what is an indica and what is a sativa. And he found out that, or his theory here is that any terpene that ends in OL, which means it's an alcohol group, is if your cannabis has OLs in them, like linalool, citronol, that those would be indica. So it's an interesting little side note. It used to be that we looked at the myrcene content, and any myrcene content higher than 0.5 was considered an indica, but none of that stuff matters anymore. sadly. It's very depressing. It doesn't fall into neat little packages like I wish it did.
And we did have a question about the terpenes. Maybe talk a little bit more about terpenes. Not sure I understand fully. Are they in CBD?
A lot of CBD has, it's called full spectrum, and a lot of CBD that you purchase has terpenes added in. Like if it is flavored, it's going to have limonene in it, and so it's going to have a different effect. If it has peppermint, it's going to have different terpenes in it. If it, so yes, it is very confusing, and I understand it's confusing, and that's this whole language that we have to keep saying and repeating and talking about, so we get more comfortable with all these weird words and these weird concepts. But terpenes are the thing in cannabis that direct traffic. So terpenes tell THC and CBD how to behave. So yes, you could buy CBD that has terpenes in it, absolutely. And that's why you have to get educated about it to understand, does your child have seizures? Does your child have anxiety? Are we trying to calm them down? Then perhaps we want to look for like a lavender CBD or something to address those particular issues. Somebody was also asking about, tics and things associated with ASD. And yes, cannabis has been shown to help with that, especially CBD with things like linalool and myrcene, things that are more calming. So yes, great questions.
Mm-hmm. Good. Do you give discounts on dispensary products to ASD patients?
We don't have a category for ASD, but we do have different categories. I know we have a 22% off for veterans. We have for our older population, we definitely have discounts. We have a first-time discount of 10%. But the nice thing about Greenhouse is that every day something is on sale, so that patients who are buying, say, tinctures will know that Tincture Tuesday, they know that they're going to get a discount every Tuesday. And we're really good about sending out text messages so that people know. And we have an online order platform that's super easy to deal with. So that said, we understand that a lot of our patients are very price conscious, as are we. And so we try and pass any discount along to our patients. We gratefully, I'm so grateful, buy a lot of things in bulk. And so with bulk pricing, we can then discount. So a lot of times our prices are lower than other dispensaries just because we can buy so much at a time. So we like to pass that on to our patients.
Good question. Okay, let me see if there's anything else.
I know that there was something about brain development, and I wanted to talk to you about that because that's really important. What they're worried about with brain development is THC, not CBD. It doesn't look like CBD is having a problem on structural brain changes. In the rodent model, there are structural differences in an adolescent brain that's exposed to high levels of THC, and they are long-lasting structural changes, but nobody knows what the significance of that is. Nobody knows what that means. Now, to me, that's certainly scary. I mean, you talk about a structural change in the brain from THC, that's kind of alarming, but we don't know if that's a positive change or a negative change. We don't know what the clinical significance of it is at all. But I do really caution high levels of THC in anybody, quite honestly, but especially in the pediatric population. Another question was, what's the youngest patient? And there's not a lot of data on children less than 5 at all that you can find anywhere. And certainly we don't see at our dispensary a ton of children less than 5, but how young was too young? I can't answer that question. I mean, every single patient situation is unique. And if traditional pharmacy has not treated adequately your child's issue and you are desperate to try something else, that puts you in a sort of a different category. So with all medicine, start low, go slow, be cautiously optimistic, don't expect major transformations immediately, but I have seen wonders, and I have seen patients and their caregivers coming back and saying that this has really changed their lives. So it's certainly a an option. It's not the option, it's an option. And like I said before, I'm happy to do consults with whoever. I can email back and forth with you about your particular concerns or issues.
Another question, is there a listing of MDs that certify kids who are turning 18, so they'd be switching from a pediatrician to internal medicine?
The MMCC, and it is mmcc.maryland.gov, and it's Maryland spelled out. So mmcc.maryland.gov, which is right at the bottom of this screen right here. That's where you go and you sign up for your child or yourself or whatever. If you sign up a pediatric patient, then you have to be the caregiver for that individual, and so you have to sign up as well. And on that website is a ridiculously long list of providers that certify.
Okay.
So it's not so much that nobody can certify for kids. I just know that Patricia Fry is a great resource because she's close and she does 100% certified children. She's a retired pediatrician and she has, autism experience. So she's a great resource that's in our backyard.
And I think we kind of answered this one. Are there specific insurance companies that cover cannabis more than others? And I think what you said is nobody's covering it. Am I correct?
Nobody's covering it, but if you guys can find me one, I'll certainly switch.
Right. That's great. That's good. Anybody else with any more questions to type into the chat? Feel free. We have a little bit more time here.
Yeah, let me just look too to make sure there was nothing else.
Yeah, see if there were such good questions that you will. Also, while Leslie's looking, if you all have anything, and you can type it in the chat as well, any other recommendations on other topics you'd be interested in hearing about? We're trying to throw a lot of things up on the, virtual workshops and speakers. So we're always happy to hear about other ideas. So in the chat, or you could just, email us at the office.
This is there's some really good questions here. Problems with anxiety, chronic pain, back pain, and GI pain. So cannabis is amazing to treat the gut. So the endocannabinoid system is so densely wired in the gut. There's tons of receptors in our gut. And as it turns out, that's where anxiety starts. That's where those hormones are actually produced that cause anxiety, funny enough. So some of the questions are, can cannabis help with those issues? Absolutely. We do a ton of inflammatory bowel disease like Crohn's disease, colitis, and just IBS. And pain that's not necessarily been diagnosed as a certain etiology or source. And also a lot of anxiety, as I talked to you guys about before. But we have a ton of patients who get off of their SSRIs or other anxiolytics or anti-anxiety meds. They get off their benzodiazepines, their Xanax, their Valiums. They get off their sleep agents because they're trading cannabis for that, because they either have such minimal side effects from cannabis or they don't have any side effects from cannabis, and they hate the side effects that they're getting from their other medications. So yes, we have seen a lot of, here's a question about OCD behavior. Yes, we've seen basically cannabis helps to dull the hypersensitivity that exists in anxiety, what I'm assuming exists in autism spectrum disorder, that the antennae are very sensitive and stimulus of any kind is like almost painful. And so it's almost like having a heightened anxiety state all the time. And so obviously in our verbal patients that can communicate what's happening, they just basically say that their anxiety is probably there, but they can't feel it. They can't, it's not bothersome to them at all. So in a nonverbal situation, what we're seeing is just less violent outbursts and less disruptive behavior. But really what we're doing, I think, is soothing those tattered, raw edges. And that's what cannabis kind of does. It just basically calms down. We're creating homeostasis. So something's out of whack. If something's too high, cannabis is lowering it down. If something's too low, cannabis is raising it up. It's just basically creating balance. So it's sort of the most simplistic way of looking at it, but it's helpful to look at it that way.
Very good. Can you talk more about communication benefits of cannabis for ASD children?
Yeah, it turns out that there was a significant increase in their ability to actually get their point across. So that I'm not saying that you go from nonverbal to verbal, but some of the disruptive behaviors get in the way of getting their point across. And so a lot of the parents were reporting that they just had better communication with their children in a variety of different ways, and whatever that meant for that particular individual. Because as everybody knows, communication is very individualized, and a lot of us learn how to communicate with our kids in a way that nobody else could. Nobody else would understand what they're talking about. And a subtle change to us, like maybe an individual or a neighbor would watch the interaction and not really think that was much different. But to you, who's with your kid all the time, it's a pretty profound improvement in communication. So I don't think it's necessarily that it's definable necessarily, but it's something that was observed in the patients, is that they had better communication with their children.
Good. And then exactly how much would it take to get cannabis off Schedule 1 listing?
I love that question. I love that question. So it turns out that Big Pharma does not want it, because cannabis would replace a lot of medications that are currently on the market. And Big Pharma is who pays our politicians to keep things exactly as they are. So there's a long, long history of Big Pharma who put cannabis in its place and has a lot of money intent on keeping it there. Now, I like to say the horse is out of the barn. We have something like 31 states, I guess, and DC that are now either medical or recreational. So despite our federal government being unable to get out of their own way, the states are deciding for them. But if it was off Schedule 1, then all of these individuals who are jailed or prisoned for drug charges would have to be released. There would have to be restitution. It's a big ball of wax to unwind, and I understand that. But my God, enough is enough. Enough is enough. We need to all vote appropriately when the opportunity is there. But it's a really big, deep-seated problem, and I love that question. And whoever asked it, I think we should go out for a glass of wine and talk about it more.
Good. Somebody suggested a future topic about using probiotics. Thank you. I made a note of that.
It sounds so important. I love probiotics.
Yeah. Could we pay for a televisit with you for specific guidance on what to buy?
You cannot pay me, but you can still do one with me. I love that question, but no, I'm not going to accept any money for that. It's part of what I do as being the medical director of Greenhouse, and I'm happy to do it.
All right, very good, excellent. Not seeing all the chat questions. My question is not getting to the host. Holtz, do you want to unmute yourself and ask the question? Let me see where you are. I want to make sure you get your question.
Hi, that wasn't said that.
Oh, that wasn't you?
Nope.
Oh, sorry. That would have been LDRCO517. Can you unmute and ask your question if you're not seeing it on the chat? Or I can unmute you. Question.
Thank you, but I got my question answered.
Oh, you did. Excellent. Okay. All right. Good. Just want to make sure we got everybody. And I think we have one more in here. Will it be hard to get approved for a government job if you take CBD or cannabis?
CBD is not being tested for. So as long as you're buying reputable CBD that's not tainted with THC and it's not going to show up in a blood test, you're going to be completely safe taking CBD.
Okay. Great. Very good.
I can tell you it's going to be fine. But you're tested. And if you are taking THC, there's a chance that you will test positive. Depending on your government job, some people get polygraphed and they have to answer the question, are you taking any controlled substances or illegal substances? Sometimes people have planned drug tests, urine tests, and sometimes they are sprung on them and they have no warning. So if somebody is inhaling or smoking cannabis in large quantities, that is going to linger a little bit more in the body. But you need about 14 days to get those levels to go down low enough so that you could pass a drug test. It turns out that when you eat cannabis by sublingual or elixirs or tablets or whatever, you're not as likely to test positive, even if you take it every single day, because the compound that they're looking for is one that comes from smoking or vaping, not as much from eating it. So it's a very convoluted, horrible answer, and I apologize, but it's not an easy question. And it sucks because so many of my patients are really conflicted about what to do because they are in agony and they really want the help of cannabis, but they don't want to test positive. So depending on what your particular situation is with how you're tested and how often you're tested, it might still be an option. But, THC is very, very misunderstood. THC is a very, very potent molecule. And that means that you don't need very much of it to get the job done. Too little doesn't work and too much doesn't work. But it's kind of like Goldilocks, just the right amount is kind of perfect. And so sometimes people are really overusing their THC because a lot of patients use it recreationally and don't understand the way to medicate for their symptoms in a more intelligent way. So I guess the really long answer is that if you are using a modest amount of cannabis daily, you might actually still pass your drug test. But I would never, ever encourage somebody to take that chance. I basically say, listen, if you're taking anything with THC, you have to be prepared to fail a drug test if you're not given enough time to abstain before that test, which sucks, but that's the world we live in right now.
That's great. Any more questions? I don't see any more in the chat. This was awesome. Thank you.
Oh, you're welcome.
Yeah, it really was, Leslie. Super. And you guys asked the greatest questions.
Oh my God, the smartest group I have spoken to in such a long time.
I really learned a lot, and we really appreciate it. We are recording this session and we'll be putting it on our website hopefully in a couple days. We're trying to figure out how to do all that now so that other folks can access it and learn about all the things that Leslie has shared tonight. So I just want to thank you, Leslie, for being with us tonight. It was a wonderful presentation, and I know everybody appreciates everybody putting in here. Terrific, Dr. Apgar. I'll be in touch. Yeah, so lots of thank yous in the chat. So.
Oh, sure. It was my pleasure.
Very much, you guys, and have a good evening, and please reach out if there's anything. We've got lots of resources available, COVID related and otherwise, and we're here. Suzanne Mason's online. She's in our office, but we're not in our office, but we're certainly able to get your emails and phone calls. So please feel free, if there's anything else we can help with, to reach out, or any ideas. So that's great. Thank you so much.
Yeah, and you guys stay safe, all of you, please.
Yes, everybody be well and be safe. Thank you. All right. Good night, you guys.
Good night.
Thank you.